Hi guys, this is Louis here from MedDXTesting.com, and in today's video we're going to discuss the most important thing that we could do to stay healthy. Now, what do you think that could be? Well, most people will probably say diet and exercise. I mean, diet and exercise it's important. I mean, we need to maintain proper weight. We need to consume good nutrition. And we need to take care of our bodies for sure, because if we don't take care of our bodies, and then if we increase in weight, it's not good. When it comes to food, we need to eat right, for sure, right? I mean, I would say there's three major foods that we should never eat, and that is canned food. Canned food is not good for you because it just has too much sodium. And then you got frozen food, lots of sodium. And then you have fast food. Fast food is one of the best ways to get sick. So if we eat properly, if we exercise, we're going to be healthy. But guess what? That's not the most important thing. I mean, you could diet all you want, you can exercise all you want, but the most important thing in life is not diet and exercise. The most important thing in life that sets the foundation of health is sleep and breathing. If you don't breathe properly, it can destroy your life. And one of the reasons that I know about this topic a little bit is because it was destroying my life. Now, this video is a segment of three previous videos that I took out that had to do with anxiety and high blood pressure. Now, let me tell you something really quick. A doctor can only do so much for you. You are the best person to take care of your body. A doctor's never going to be able to take care of your body the way you take care of your own body. You know your own body. And today we have so much digitized information. We have so much information that we really do not have an excuse of not to take care of ourselves. And one of the reasons that we're doing this channel is to be able to bring medical digitized information so we can keep as many people as healthy as possible. They can find solutions to their problems. Now, like I was saying before, I was diagnosed with high blood pressure and anxiety, and I never had high blood pressure before. I never had anxiety. But guess what? The doctors didn't know why. I didn't know why. And I discovered quickly, and this time I'll get to the point. In fact, one of the subscribers I was speaking with about 15 minutes before I got to the topic, he's like, can you please get to the topic? I mean, you know, when you have a 20-minute video and people don't have the patience to listen to you for 20 minutes, really, I mean, people just want fast answers today, and the world doesn't really work that way. Sometimes you need to be patient, and by being patient, you could find answers to your problems that can change your life. Imagine 20 minutes and you can change your life. I mean, you know how long it took me to be able to change what was going on with me? It took me years. And yet I'm able to provide this information today. And if you're having some issues, if you're having some problems, then we can help you. And that's why today we're going to discuss the importance of breathing and sleeping, because it's the foundation of health. And if you don't breathe properly, if you don't sleep properly, you have nothing. When I was diagnosed with high blood pressure and anxiety, I did not know why I had it. And then I found out, and I diagnosed myself, I had sleep apnea. The sleep apnea was causing anxiety. What happens is when you have sleep apnea, you develop anxiety, you develop high blood pressure, and you develop a fast heart rate. Top three. You develop insomnia, you develop depression, you develop all kinds of abnormalities. And if it goes unchecked, you can develop diabetes and all sorts of cardiovascular issues. So I caught it just in time. But I was able to diagnose myself because the doctors were always saying this is a genetic disposition. Maybe you got it from your parents, or, you know, my parents have nothing to do with me. There's always a reason. No matter what happens to you, there's always have to be a reason. Okay, and then my particular reason was that I developed sleep apnea. But the question is, how did I develop sleep apnea? Well, because I wasn't breathing properly. So there's two ways that you can breathe. You can breathe through your nose, or you can breathe through your mouth. Now, your body needs oxygen. Your cardiovascular system, which is composed of arteries and veins, needs oxygen. Your peripheral nervous system, which is composed of nerves and muscles, needs oxygen. Your brain cells needs oxygen. Your autonomic nervous system in your body needs oxygen. Your organs needs oxygen. But it needs the right type of oxygen. It needs the oxygen that comes through your nose. When you breathe through your nose, that oxygen gets filtered and it can nourish your body. That air goes into your lungs, it goes into your brain, and it can really keep you healthy. But there's a silent pandemic. Not pandemic. With this going on, it's not a pandemic. Epidemic. A silent epidemic. And it's mouth breathing. A lot of people do not know that mouth breathing can destroy your lives, because mouth breathing causes sleep apnea. Mouth breathing can destroy the shape of your face. Mouth breathing, when you're young, what happens is that you develop an overbite. You also, it kind of drags your face lower. You develop an overbite. You develop crooked teeth. You develop gingivitis. You develop a lot of dental issues, and that's not a good thing, and that was not an exception. It happened to me. I was a mouth breather for a very long time until I discovered that 3 years ago that I was a mouth breather and mouth breather. So later on, we're gonna do some research, and I'm gonna show you guys, because some people need to see. And I'm gonna show you guys the difference between a mouth breather and a nose breather. So it's really important that when you sleep, or during the day, for instance, you always are breathing through your nose. Nice, calm, and collective. You never want to breathe through your mouth. If you breathe through your mouth during the day, you're going to breathe through your mouth at night. And at night, during breathing through your mouth, it's really bad, because you're doing a great harm to your face. You're not getting the right type of oxygen going into your body. And if you don't get the right type of oxygen going into your body, guess what? You're going to get sick. And I said this in one of my previous videos. If you're in a room and they cut off the oxygen, what do you think is going to happen? Well, eventually you're going to pass out, because there's no oxygen. And if no one gives you oxygen, you can die. So what do you think is going to happen to your body if you do not get the right type of oxygen? It can affect you. So if you don't have the right type of oxygen going into your body, you can develop a lot of different diseases. Most of the diseases comes through the mouth. What happens is that when we sleep, we do not know how to sleep. We do not know in what position to sleep. But one of the worst positions that we can sleep, it's in our backs with a flat pillow. Because when we sleep on our backs with a flat pillow, we're going to have the tendency of opening our mouths. And one of the reasons that we snore is because we have our mouth open. So if we have our mouth closed when we sleep, then that's not going to happen. Now, it's really important too, as we age, that we start breathing only through our nose, because it can really affect our health. Like I said, you can develop stress. You can develop anxiety. You can develop high blood pressure. You can develop cardiovascular disease. Okay? You can develop diabetes. You could develop arthritis. You could develop osteoporosis. Because what happens is, if your body's not getting the right type of oxygen, what do you think is going to happen to your bones? Not good. The same thing with the bones of your teeth. If you don't get the right type of oxygen going into your mouth, if you breathe through your mouth, it's going to affect your teeth. It's going to affect your gums. It's so much that comes bad from breathing through your mouth that it can destroy your life. Not only it can destroy your life, but it can destroy the shape of your face. And as a young kid, if you have young kids, if you have grandchildren, one of the best advice, and I know that every time my kids, when they go to sleep, I always remind them, sleep on the side, close your mouth, and breathe through your nose. When that type of information is in your subconscious, you're going to remember. I've been able to put this information into my subconscious, and when I wake up sometimes in the middle of the night, I'm in a position where it's not that easy to open your mouth. But if I wake, sometimes I do wake up, and I notice that my mouth is closed, and my tongue is also in the right position. In another video, we're going to speak about tongue posture. Tongue posture is really, really important, and it's really important that we have proper tongue posture when it comes to our breathing, our habits. So what I'm going to do now, I'm going to show you a video. We're going to do some research, okay? We're going to go to Google and we're going to research. You're going to see the difference between a mouth breather and a nose breather. So you can see the difference between the shape of the face, and you can see for yourselves that one of the worst things you could do in life is to breathe through your mouth. And one of the best things you could do, and one of the things that you have to learn how to do, is to breathe through your nose. Now, there's some individuals that they can breathe through their nose because maybe they have a deviated septum, or maybe they have some sinus issues. There could be many implications, but then if that's the case, if you can't breathe through your nose, then you're going to have to get a CPAP machine. Those CPAP machines, if you're not careful, you can even catch an infection. So definitely, if you can't breathe through your nose, then I definitely suggest for you to go see an ENT doctor. If you need surgery, then get it. But you need to do whatever it is that you can to breathe through your nose. So we're going to do some research, and then we'll come back and we'll wrap it up. Okay? Bye. Okay, so let's go to Google real quick. So we're here. You see the top picture. Top picture is an individual that he's a nose breather. Good definition of cheekbones. An individual has straight teeth, and he has a nice wide face. Look at the same individual at the bottom. Mouth breather. Poor definition of cheekbones over time. This is exactly what happens. This individual develops crooked teeth, narrow face. This happens over time. We're not born this way. Again, look at crooked teeth at the bottom, narrow face. This is what happens when we start breathing through our mouths. That's not a good thing. We want to be able to breathe through our nose so we can look like the person on top, and we should start doing that at a very young age. And I know my kids, like I said in the video, I always told my kids to breathe through their nose and never breathe through their mouth, because then they can get sick. Look at the picture on top. Lowered eyes, right? Straight nose. The person has good airway size. Look at the bottom. Mouth breather. Same individual. Look what happens. Tired eyes, a crooked nose. This individual develops small airways. So what do you think is going to happen to this person later on? Look at the top again. The top, well-developed jaw. So when we breathe through our nose, we can develop our facial structure. When we don't breathe properly, then this is exactly what happens. What do you think is going to happen to the kid, to this individual in the bottom? He's going to develop a lot of issues, you know. You can develop asthma. You can develop, as a young kid, you can develop depression. There's so many kids that are depressed, and this is one of the major reasons. I'm not saying that a kid that is not well defined, like the person on top, can develop asthma and can develop anxiety, but you definitely don't want your child's face to develop like the person at the bottom, because he's doing it to himself. We want to be able to tell our kids to be able to breathe properly, and as we get older, that we want to be able to breathe properly, so we don't start developing a receding jawline and start developing some issues. Profile of a mouth breather. Again, how many people have you seen in your life that look this way? Now what happens is, now you're going to start training your eyes. Now you're going to know the difference between a mouth breather and a nose breather. Look at this young kid. He did it to himself. Crooked nose. Okay? Receding chin, small airways, narrow face, bad posture. What do you think is going to happen to this kid? This kid's going to develop sleep apnea. This kid's going to develop all kinds of issues. It's going to go into another picture. Let me see which picture it's going to go into now. Now, all the research is out there. You could do the research on your own. You can YouTube the research, and you can Google the research. So you can see pictures. A lot of people on YouTube use these pictures. Now, look at this lady. Okay, if you start telling your child, your daughter, your son to start breathing properly, the face will develop in a nice way. Nice, good cheekbone, straight nose. Okay. Good posture when it comes to your mouth. Well-developed jaw. This is a nose breather. I'm not saying that maybe you can't have some issues, but if you breathe through your nose while you're young and your face is developing, it's going to be a lot better than. Now, look at what happens to your face when you breathe through your mouth. This is insane. And yet you go to these dentists and you go to orthodontists and you go to these physicians and they never tell you anything. And it's right. You know how many kids I see sometimes, they have asthma. And I know why they have asthma. They have asthma because they're breathing through their mouth. Again, if we breathe through our mouths, as we start to get older, let's just say we look like picture number one. Once we start to get older, we have the tendency of starting to breathe through our mouths, and then we start receding that chin. That chin starts to recede. We start getting a saggy jawline. We start developing fatty tissue on the neck because now we're developing bad posture. We start developing an overbite, and that's not good. But guess what? If we look like this when we were young, and then all of a sudden we start to get older and we start to look a little bit different, all we need to do is seek an orthodontic consultation, and then maybe we can get maybe Invisalign or whatever. There's a lot of things that an orthodontist could do that can make you look this way again. You give you an automatic facelift, improve your bite. Okay, you never want to look like picture number two, and all of a sudden you want to get fillers. I can't emphasize how bad that looks when I see a woman 50, 60 years old with a tremendous overbite, a sagging face, and they think that maybe by getting these fillers they're going to look good. Now, you want to fix the foundation of your face, and the way you fix the foundation of your face is by getting an orthodontic consultation, even when you are much older. Especially if you never had braces. Most people maybe have braces, but if you never had braces, that means you have good. So you still have good, strong bones, and you can probably move some bone around so you can straighten out your face and you can look attractive, and that's the most important thing. You want to be able to look healthy. You think this lady here is going to develop it's going to have sleep apnea? No, I don't think so. This person here in number two will definitely have compromised airways, and because the chin's all the way back. And what's going to happen when that person goes to sleep? They're going to open their mouth. Well, obviously they're going to open their mouth because one of the reasons that they ended up this way from the very beginning is because they were a mouth breather. In picture number one, I guess we can say that this person also has good tongue posture. The tongue is really important because if you have the tongue on the top of the roof of your mouth, it will elevate your face. If you have your tongue, and that's why mouth breathers develop bad tongue posture. Okay, nose breathers develop good tongue posture. You want your tongue to always be in the roof of your mouth. When you have your mouth closed, that tongue has to be in the roof of your mouth, and what that does, it elevates your face. It elevates your cheekbones. It gives you like a really micro facelift when you're doing that. If not, then your face is going to drag. And when you see older people, when they get older, their faces, it's lower. They have a receding chin, maybe some fatty tissue around the jawline. All that happens because of breathing. I'm not saying, listen, we are getting old, but if we age gracefully, there's people who are very natural, and they're older. They look good. We can definitely look good as we age if we breathe through our nose. Now you see the implications of being a mouth breather. I mean, you could develop a lot of issues without a doubt. And I was a mouth breather all my life, and I just wish that when I was 17, 18 years old, somebody would have told me, Louis, you're breathing through your mouth. It's really important that we learn to breathe through our nose. Now, one of the things that we can do, it's really important that we keep our rooms clean. It's definitely clean. Windows, especially behind our bed, sometimes we can collect dust. We gotta move the bed and make sure that there's no dust behind. We gotta make sure that the rooms are spick and span. Why? Because we sleep there, and when we breathe, we don't want to be breathing in dirt. And sometimes we think that the rooms are clean because maybe we clean the room superficially, but it's not. So we got to make sure that our rooms are a deep clean. Sometimes my room is clean, and I move the bed behind, and there's a lot of dust there, and guess what? I'm breathing that dust. And sometimes I know that because I wake up a little stuffy, and it's because there's some dust over time. You develop dust behind your bed, and you got to be able to move it, because if not, you're going to breathe that. Every now and then, what I do too is I bring an air filter into my room and make sure that clean the air. Not all the time, but sometimes. And the reason I have this plant here, because this is a house plant. I keep it near me, and this kind of purifies the air. So that way I know that I'm breathing good fresh air. Also, what I do too, how to make sure that you're breathing through your nose and not through your mouth when you're sleeping. Now, we mentioned before that it's important that when we are awake, we're breathing through our nose. We keep our mouths closed and we're breathing through our nose. So another thing that I do, obviously when I sleep on the side, a little elevated. Make sure that I'm not going to open my mouth. I don't want to take any chances. I'm going to show you guys something you might think, oh, but the research is out there. I mean, I found out about it because I had researched a lot of individuals, professionals with PhDs, that they were mouth breathers, and all of a sudden they found out. And one of the things that I learned is that, and I don't play around sometimes. I mean, I don't do it every night, but I put tape in my mouth. Now, there's two types of tape. There's put a little bit here. I don't want to put that much. Okay. There's two types of tapes. There's the tape that you can put across your mouth, but it has a little opening, right? And then you can, if you open your mouth, then you'll be able to breathe, because you might open your mouth, but that helps you when you have that tape. It helps you keep your mouth, because you really can't open it. But then what I do, and I learned this on one of the individuals, this physician that had this problem. So then what he does, he puts the tape like this. Okay, so I do this at night. I don't play around. I could still talk. If I wake up in the middle of the night, if I breathe through my mouth, I could breathe, but I can't keep my mouth open. I have to close it. I sleep really well. I sleep deep. I have deep dreams. I wake up nice. When I used to have anxiety, my goodness, I used to wake up in bad shape. You got to just go back and look at the videos. Maybe I'll link in the description. I always say that, but I never do. There's two videos you can watch. How I cured, one of the videos says how I cured my anxiety and high blood pressure. And then another video that is really good to watch is the #1 hidden reason of high blood pressure and anxiety. And obviously it's sleep apnea and mouth breathing. That's a really good video, because I go more in detail. If you breathe properly and if you sleep properly, that could be that is the foundation of health. And you want to be able to do it, especially as we start to get older, in your 50s, in your 60s, and your 70s. Listen, I'm 52 years old, and I have learned how to take care of myself, and I'm always doing different things to be able to have a healthy soul. Okay, especially when it comes to my facial structure, my breathing, my sleeping. You got to be able to take care of your body. I'm going to speak about that on another video. You got to be able to have the proper weight according to your body structure, because if you're too heavy, now what that's going to do is you're going to put unnecessary pressure on your cardiovascular system, which is your arteries and veins. You just can't do that. You're going to put unnecessary pressure on your peripheral nervous system, which is your nerves and muscles. You don't want to do that. Okay? Every muscle you have in your body, you have a nerve attached to. You want to keep your muscles healthy, but if you're overweight, then it's really hard to do that. You want to be able to eat good nutrition. Like I said, there's so much information out there. There's just no excuse for you not to stay healthy. And remember, the foundation of health is breathing and sleeping. Subscribe to our video. If you found this video interesting, refer this video to one of your friends. Speak about it if you find it helpful. If you have any comments, if you have any questions, then you can comment below, and I'll try my best. I always try my best to, it's a new channel, so I always try my best to get back to everyone. Some people have complicated questions, and I have a lot of information that can keep you healthy, because this is stuff that I'm doing, and that I'm learning how to take care of myself, how to take care of my kids, how to take care of my wife, and I'm bringing this information to you. So again, turn on your notifications, subscribe to the channel, and I'll see you in the next video. Bye-bye.